session based on families. How do we engage Latino families in being able to make a shared decision on improving lifestyle, on making lifestyle changes for both their kids as well as their families, and we're partnering up with that one. I'm partnering up with that one with the School of Dietetics, the Association of Dietetics and Nutrition, specifically the LAHIDAL members who are all of the Latino and Hispanic in dietetics. So again, collaboration, coalition building, talking about family-based approaches, talking about Latino needs, and recognizing that the needs might be different. Right, and then you can become a member. Okay, we definitely appreciate the support, appreciate your input, your collaboration. You're going to see in the next few slides that how our current chapter is structured, and you'll see that we have right now definitely some positions that we would like to have here in our state, in Nevada. It's important to recognize that Nevada is a state where we have 3 main city centers. Okay, we have 3 main city centers and not much in between. Okay, with the largest city being down south in Las Vegas. Up here being where the capital of the state is, as well as Reno, which is the second largest city center, and then up north in Elko, where you end up having a smaller city center as well. This geographic divide has made it difficult for us to be able to garner more members, to be able to enhance our networks, to be able to collaborate across the state. Okay, and a lot of that has to do with the geographic divide, but some of that also has to do with the fact that we are maybe not collaborating as much as we should. There are not enough routes of communication through work that we can actually utilize, and we definitely mean to be able to grow that as the NHMA chapter. That's why when we designed the chapter for our state, since its inception, we designed it with a whole state mentality. What do I mean? So we ended up making the position. Oh yeah, no disclosures. I drink a lot of coffee and I try not to drink enough this morning so I don't jump around. We have our own logo, which is nice in Nevada. It's new also. And then the current leadership of the chapter is me as an outgoing chair, Dr. Fernandez coming in as incoming chair, Dr. Nectari Barrera, who wasn't able to join us today, has joined as our UNR-based resident representative. Okay, so the positions that we have right now, these are pretty much the 3 main positions that are actively looking for opportunities, collaboration, trying to do different things. Okay, and but you will notice that all 3 of us are up here in Reno. Okay, so when we came up with the chapter, and when we structured it at the beginning, we structured it for it to be a dual chapter, for us to have representation both north and south. Okay, at that time, we were lucky to count we duplicated some of the positions. The UNR, the resident position, is a dual position. So we have a UNR resident representative. We don't have a UNLV or Las Vegas resident representative, which we still have it vacant. Then our non-physician member positions, also we duplicated them. We were able to start with at the time the head of the Nevada Minority and Equity Health Coalition as one of our founding non-physician members and chairpersons, board members. And then Oscar Delgado, who is here, who is running the Community Health Alliance, continues to serve as our non-physician member up here. But we have right now the space vacant for Las Vegas. At this time, we don't have early career physicians that have come forward to be able to fill the positions, looking at both North and South. And we are actively recruiting for that. And then our advisors, we have one up here, Dr. Jacobs, and then down south, Dr. Gaspar de Alba as well. And then now we have had more frequent conversations with Dr. Greer as well. So if you wouldn't mind throwing your hat into being one of our advisors, we would really appreciate it.
My kids don't want my advice.
That's okay, we don't have to be related, it's fine. But they're definitely trying to come together and build a coalition and try to support our state's needs is also going to include being able to navigate that geographic divide, sometimes even the political divide. The work that we have been involved in over the last year has included multiple highlights. This is from the year before, okay? We continue running our Acá Entre Nos community sessions now as part of the Community Health Improvement Plan in Washoe County, in the Washoe County Health District. This year we have already done 2 sessions and we are planning on doing 4. And after from the last year to now, we actually exceeded expectations for what the program was meant to offer, which was a safe space for Latino families to come and talk about their mental health needs. Respire Bien Nevada, the web page is live and running. We are right now, I currently am in early conversations with one of the larger tobacco coalitions in the country for them to be able to take over management and upkeeping of the web page, because on my own I am unable to do so. Dr. Fernandez and myself have been continue serving as ongoing, I don't know if co-anchors would be the right word, but recurrent guests that show up on Telemundo Reno talking about different public health initiatives and also other types of health considerations, focusing mostly on preventive health and access to care. And then last year, Dr. Fernandez, myself, and Oscar Delgado were co-introducers of legislation for the Nevada Hope Act, as well as I myself on one of the tobacco cessation generational bans for tobacco sales in the state. This year, reason why I added the previous slides is because that's all includes some of the ongoing work that we continue to be involved in. This year, we visited Senator Cortez Masto's office in DC with Dr. Miguel Villagra and Dr. Fernando Fuentes. Both of them are current enrollees in the NHMA National Leadership Fellowship Program, and they were both supported by our chapter. They are both chapter members. We held our first community-based event where we were able to present in partnership with the Mexican Consulate in Las Vegas, as well as the Student Outreach Center at UNR, on doing healthcare screenings and talking about healthcare recommendations and resources for families. I was able to talk about vaccine hesitancy twice and talked about a couple of kids there, but the real stars of the show were both our students from the Student Outreach Clinic who performed the active care and screenings, as well as our 2 residents, including Dr. Barrera, who were the ones precepting and mentoring our students. I was there to just cheerlead and then deal with kids. Okay. We were invited to a meeting, just like Dr. Garcia earlier mentioned, that I was in that meeting as well with Secretary Becerra and with Dr. Reynoso as well. Late last year, where we just talked about collaborations within Reno and talking about, okay, so why is it important for us to have physicians and have healthcare workers come forward and talk about pathways and talk about mentorship and talk about ownership and representation and being present, especially and having support for people who were willing to do community work. This is our pictures of our last year's conference, where Dr. Elena Rios ended up doing our initial intro. Dr. Lombardero, you'll see yourself there. year. That's from your presentation last year. And again, this is our third year doing this conference. And I'm glad to say that, as you saw from the lively discussions, we have been lucky that we have selected great speakers, and we have had good discussion generated and connection generated from this. These are our flyers with the speakers from the previous years. And then Dr. Fernandez, she was recognized nationally as one of NHMA's 40 under 40. Yeah, you know, we know we're in good hands. These are just some of the work that we have been involved in, both on outreach, op-eds, interviews, and then the rest of them are media-based on TV, Telemundo, and multiple other sources. For me personally, my big I don't know if pride would be the right word, but one of the key things for me on a personal level was an opportunity that NHMA, from my local work in tobacco, in just tobacco cessation and tobacco education, I was able to present for the Office of Management and Budget at the White House earlier in the year on menthol cigarettes as an NHMA supported physician. That happened in February, I think. As they were hearing input from different groups, they called for the Latino aspect. Okay, so we're talking about menthols. We don't want menthols. We want to get rid of menthol cigarettes. So what's the Latino take on this? NHMA called for people, and I was one of those people. I presented for the Office of Management and Budget. So again, the local work growing into something more definitely is there, and that all reflects on the work that our state and our chapter has been able to do. So you know how to find us. You'll get my email. You can follow us on Instagram, Facebook, LinkedIn, and I don't know through social, but you probably can. And then please reach out. We definitely want to talk to you guys. This whole conference this year was structured around being able to support Latinos going into science and medicine. We definitely want to hear from you guys, because all of these examples are just examples that we can do things, and that we have a voice, and that you can make changes for the best. Thank you.